Welcome to the Advanced EHR training video for Free Chiro. Today we will discuss additional features in our software that can help you enhance the use of Free Chiro. First, we will discuss different ways to schedule patients to accommodate your scheduling needs. First, we'll access the scheduler. Let's say you want to double book a patient. This means you will have two patients during the same 15-minute interval, and it would be very useful if you see multiple patients in a short amount of time. To double book, we're going to click on the time slot and patient name we want to have another appointment. At the top of the pop-up window, there will be an option to create another appointment at this time slot. Once I click on that checkbox, I can put in new patient information. I click Save at the bottom right of the box. And as you can see, I now have a double booked appointment for George Smith and Steph Curry. You can also schedule recurring appointments with our software. First, click on the time slot where the occurring appointment will occur. After filling in necessary patient information, I click on Recurring Appointment at the bottom right of the screen. This will bring up a new window in which I can choose my recurring appointment options. I can choose the status. I can also change the start time and the duration. And I can also determine the recurrence pattern. I have three choices: daily, weekly, and monthly. If I choose daily, I can have the recurrence pattern occur every day. If I do 2, that will mean every other day. And if I do 3, that will mean every third day. The same goes for weekly, except I can also select which days of the week I want to see the patient. So let's say I choose Monday, Wednesday, and Thursday, but I want it to happen on every week, so I'm going to say 1. I can also do monthly, in which I can do the first, the second, the third, or the fourth specific date. So if I say the third Monday every month, or every 2 months, I can make that recurrence schedule happen. So today we're just going to do every week for Monday, Wednesday, and Thursday. And we have a choice of how long this recurrent appointment will go on for. So I can actually do it by 2 ways. I can do it by the amount of occurrences. So if I want this to happen at least 3 times, that a patient sees me one day, Monday, Wednesday, and Thursday, I can put 3. Or if I have a specific date, I can click on this button, End By, choose a date. Let's say we want to end it by July 4th. I click Create, and a list of all appointments created within that time frame will already be scheduled. If I go to next Wednesday, I can see that Kevin Lee has been booked at 12:30 on Wednesday and on Thursday, as well as on Monday, July 1st, Wednesday, and Thursday. Now we will discuss the different ways to save a patient chart. The most common ways to save a patient chart are pending, completed, and void. Completed charts will be saved within a patient's EHR chart, and a voided chart will be removed. A pending chart is remained open for edits, and a list of your pending charts will always appear on the right side column of your EHR clinical desktop. The 2 other ways to save a chart are as complete and as ready for exam. This can help with your practice workflow so that only the provider can mainly focus on the patients who are ready to be seen. The Ready for Exam tab is useful for practices that have front office staff that may intake patient information. For example, If the front office staff inputs medical history, social history, and smoking status, they can save the chart as ready for exam. This means that when the provider is on their clinical desktop screen, they simply click on the Ready for Exam tab, and this tab will have an indicator icon stating that there are patients who are ready to be seen for the exam. I can click on the patient chart. It will open to where my front office staff has left off. I can also save a chart as for review. This function is useful if you want to have another provider check your chart. You can simply select the user whom you'd like to have review your chart and a comment. Click Save. And the next time that user logs in, they'll be able to see the For Review tab and see the chart that they need to review. Please note that if you have saved the chart as Ready for Exam or For Review, they will only be accessible through their corresponding tabs. You cannot access these For Review or Ready for Exam charts in the Pending Charts column. You can access the patient chart always through the Patient Search tab. Now we're going to move into some advanced encounter sheet customization. Let's say that I want to make a SOAP note from the initial chiropractic encounter sheet. First, I would like to make a copy of that initial chiropractic encounter sheet and just remove items that I won't need in the SOAP note. To create a template, let's go to the EHR Advanced button and click on EHR Admin. This will bring us to the encounter sheet screen. To add a completely blank sheet to fully customize from scratch, you would click on the plus icon. This will bring me to a new window where I need to fill in the name, the code, set the alert options, the listing order, and who it is available to. However, we want to make a copy so that it will save us a lot of trouble by not having to recreate every level 1 and level 2 from scratch. So let's go back to the EHR admin and click on Copy Sheet next to the plus icon. This window will appear, and we will need to select the encounter sheet we would like to copy, the chiropractic examination, and give a name to the new encounter sheet we would like the information copied to. So let's call it the chiropractic SOAP note. Click Save. And now I have a chiropractic SOAP note in which I can edit. And if I go to the AdvancedEHR clinical desktop, click on a test patient to edit the encounter sheet. If I go to SOAP note, it will look exactly like the chiropractic examination. So I'm just going to come in here and remove items I don't want. So I would do that by double clicking on the level 1s, clicking on the active checkbox to make them deactive, and click Save. I can go through my subjective and objective sections to remove things I don't need, such as the new patient intake. We don't need that for a SOAP note. And we don't need some of these level 1 options, so I can just double click on them and remove them. So we're getting rid of all the orthopedic tests. And now our SOAP note is ready to go. Now let's say I have a very specific level 1 component that I created from scratch and I'm quite proud of it, but I want to move it to the chiropractic soap note. So let's go get that level 1 component. It's going to be in the re-exam, and it's going to be my treatment plan. I spent a lot of time on this treatment plan putting in the level 2 rights for all these level 2s, and I want it to be in my chiropractic soap note as well. So to do that, I would double click on treatment plan, and at the bottom I have this area that allows me to copy this level 1 to another encounter sheet. So I'm going to take this encounter sheet, it's in the chiropractic re-exam, but I want it to be in the chiropractic soap note, and I'm going to click save. Now when I go to the chiropractic soap note, I have two treatment plans. One doesn't have the one I want, the other one does, so we're going to remove the one that does not. And now I have the treatment plan that I want for this chart. Now we're going to discuss setting alerts and reminders for a patient. To do that, we have to select a patient, so I'm going to select Mr. Johnny Doe. And we want to give him an alert. So I would come down here to the Alerts tab, and this will bring me to the Alerts and Reminders tab. I'm going to set a reminder, and I'm going to add a reminder by clicking on this plus icon. When I click on this plus icon, a new window will appear for me to choose an alert. I want the type to be a recall, the category to be consultation, and I'm going to give the alert a name. Let's just say that patient allergies. And in details I will say patient is allergic to latex gloves. And I want it to start showing from today. So I'm going to select today's date, set pending, and click save. So when I exit out of Johnny Doe's chart and re-enter it, a new alert will pop up saying that this patient has a clinical recall and alert. When I click on it, I can see the alert. I can see that the patient is allergic. I want to see more of the details, so I'll just click on the text and it'll tell me exactly what the details are. If I don't want to make any changes, I just close out of this, and the alert will continue to stay on until it is removed. Now, let's say that you finished a chart and you want to update it or add an addendum to it. To do that, we would go to the Patient tab in our clinical desktop and search for the last name. Select the patient and go to the visit history at the bottom. We're going to select the date of service that we want to update or amend. So we're going to go to 5/22. We're going to click on that. And once we scroll down, if we scroll down to the bottom, we have these options called Addendum Correction, Update, and Additional Information. So I want to update this chart. I'm going to click on Update, and a box will appear. Make sure you expand it all the way so you can see the Save and Cancel button. And I'm just going to say that Dr. Lee has updated the patient's surgical history in his chart with date of service of 5/30/2013. So once I click Save, it will show that the above note was made on the date and time by the username, which is me, admin. It will state the update that you have put in. And that's how you do addendums and corrections for completed charts. So to add and remove face sheet items, I'll go to a test patient and click on the face sheet button. And I can see I have many different types of face sheet items that I do not want, such as smoking status, social history, and the family history. Those things aren't really important to me and I want to get rid of them. So to do that, I would go to the EHR Admin tab and click on EMR Lookups. Once here, I will look up the type, highlight value, and click search. And this will show me all the items that are located on the face sheet. So I want to get rid of smoking status right here. All I need to do is click on it once, and a window will appear. I deactivate it by unchecking the active button and clicking save, and it will be gone. So let's do social history, smoking history, as well as family history. To refresh my values I did, I'll click on search again and see that my family history now says no on active. So if I go back to the patient's chart and click on the face sheet, smoking, social history, and family history are no longer on the face sheet. Now the last item we're going to go over is a canned sheet. And a canned sheet is what you use if you see a specific type of patient more often than most, and you just want to have the level 1s already filled in. Now I highly recommend only doing this on a test patient. We're going to do it on the chiropractic examination. Click New Encounter Sheet. And I'm going to fill in the different values that usually happens with almost all my patients. Allergies, they don't really have any allergies, no drug allergies as well. For smoking status, they are a never smoker. And for the patient education, I always provide patient education. And I always have my signatures. I'm going to click and save this as complete. And at the bottom, I'll have this option to say, click here to make a canned sheet from this chart. I'm going to click on it. And the new canned sheet name will be normal patient with signature. Click save. And the canned sheet has been saved. So if I go to a new patient, and I want to do a new encounter sheet for the chiropractic examination, if I go to the canned sheet, I'll see that I have the normal patient with signature. When I click the new canned sheet and click on the narrative, it will show me that I already have these values filled in, so I don't have to worry about missing those values. And that's a great way to quickly finish charts for patients that you see on a normal basis. And that concludes our advanced free Chiro EHR training. Feel free to watch our additional training videos that will help you with more advanced customization. And thank you for using free Chiro.